NABN, New Africa Broadcasting Network.
Welcome, viewers at home. My name is Dr. Nelson Aluya. COVID-19 has done a devastating work on the global continent, resulting in a lot of deaths and confusion with enormous economic, political, geopolitical, social, and psychological impact on the global space. The effect of COVID-19 is still ongoing, will result in deaths in over 1.5 million people dead today globally. We've witnessed death in our community, and it's imperative that we come together to talk about what these issues are and how it really concerns us. The vaccines are being presented right now. Nevertheless, there's a whole lot of confusion still about the vaccine. And the studies have shown that only about 14% of African Americans in the United States truly do support this vaccine. So we have 3.1 million African-born who live here in the United States. So we're beginning to be a big force. And the peer-reviewed studies show that we are one of the fastest growing communities here in the United States. And everything that concerns us, we must begin to advocate for ourselves as well. And now that the COVID vaccine is here, who else to talk about this so that our people get to understand what the vaccine means and if there's a need to take it, and also how to accept the values that come out of it so that we don't, as usual, get cut off from the advantages of using the vaccine when we refuse to take it, either because we're not knowledgeable enough or we don't understand the disease and the vaccine well enough. With me today on the studio, I have great experts and those online as well, talking about the vaccine and giving us an expert view and understanding of what it is about the vaccine. With me in the studio is Dr. Amasika Inyaku. She's an assistant professor of medicine in the Department of Medicine. She's an ID expert in the Department of Infectious Diseases at Rutgers University Medical School. Dr. Inyaku, you've done great work on the Moderna study. What does the vaccine mean to us? Is it okay that we take the vaccines?
So these are great questions. I think that for all of us that have been working so diligently, even before COVID, so many of the people that have come together that have been able to make the COVID vaccine and other therapeutic breakthroughs have been scientists that have been working in other areas of infectious diseases. And so when this global pandemic started, we essentially all put our other work on the back burner and focused all of our efforts on COVID-related success. And so what I think the rapid advance in the therapeutic and vaccine efficacy that we've been able to see is really because we've had this large global community come together and focus on one problem, and that's why we're able to see the advances that we have. So with the information that's come out with both the Pfizer and the Moderna vaccine having greater than 90% efficacy in preventing severe COVID disease, all of us are so excited that this has come forward, because what we see clinically when we've taken care of individuals that had COVID infection is we've seen horrible outcomes, right? That's the thing, that we've seen over 200,000 deaths here in the United States in such a short time. This has been devastating, not only here in the United States, but all over the world. And so to have vaccines that have greater than 90% efficacy in preventing symptomatic disease and essentially stopping having severe disease is paramount, that we as a community be the first in line to get the vaccine. Because when we do the breakdown and we look at the Black, African, and African American communities, we see that individuals in that community and in the Latino and Hispanic community have been disproportionately affected, negatively infected when they do get COVID. So this is great for, the general community. And I would say specifically for the communities that we've been talking about, that it's imperative that we say that we are going to step forward and take this instead of, like you said, being left behind.
All right, great. Thank you very much. Also online, I have Professor Igor Ofotukwu, who is a professor of medicine and is also an ID expert from Emory University in Emory, Atlanta, Georgia. This question is for Professor Igor. The African or the Black community here have a 1 in 4% chance of contacting COVID than any other ethnic group. Now we have the vaccine. Is the vaccine a panacea to either stopping completely or reducing the deaths that we record of 2,500 people every day here in the United States?
Thank you very much, Dr. Aluya, for that question. The COVID-19 vaccine, now we have 2 of them that have been that have completed their studies that we are involved in the US, the Pfizer vaccine and the Moderna vaccine. Like my previous colleague mentioned, these vaccines are extremely, extremely effective. 90%, more than 90%, and in some cases up to 95% effective in preventing infection, preventing disease. There's been nothing like this in the history of vaccination. When we started out with the development of vaccine, we were thinking that if we have a vaccine that is 60, 70% effective, it would be a home run. It would be a huge success. Beyond our widest imagination, we have a vaccine, almost all of the vaccines that are now in trial, for whom results are now available, are over 90%. That is 9 out of every 10 person that is vaccinated will be protected. And the remaining 10% who may not be protected, if you have infection after you have been vaccinated, the evidence suggests that your infection is significantly milder, does not lead to death and ICU admission, as we see with those who are not vaccinated. So this is a huge breakthrough in science. This is a huge success in science. And we must demystify the vaccine. All of the myths, misinformation around the vaccine has to be thrown away. First of all, it is not true that the vaccine was hurriedly developed. Remember that this is not the first time we have had coronavirus outbreak. The first outbreak that was recorded, the major outbreak, was in 2002 in China. Then in 2012, 2013, we have another outbreak in the Middle East. During this period, this were the period where we actually began to think about SARS-CoV-19 vaccine development. And so scientists have been working on coronavirus vaccine since those outbreaks in 2002 and 2013. So when this 2019 outbreak came out in China, we almost immediately, within 10 days of reporting the first case globally, the genetic material, the genetic sequencing for the COVID virus was made available. And so that gave us the opportunity to begin the process of vaccine development. So it was not hurriedly done. The second myth is that it may not be safe for Black people. That again is not true. And as my other colleague mentioned, if you look at the data, and these are all going to be published, from the Moderna vaccine, more than 10% of the 30,000 people that participated in that vaccine phase 3 clinical trials were Black people of African descent. More than 15% were Latinos. And in all groups of people that were studied in the Moderna study, the Blacks, Latinos, the young, the old, the vaccine was effective, the vaccine was safe. And so we believe that this is probably one of the modern miracles of medicine, and that people should be encouraged. I will be #1 on the line when it comes to my state. Thank you.
Right. Thank you, Prof, for giving us that vote of confidence that you'll be number one on the list to take it. So if you take it, I'm sure a lot of us would also, and the community would trust that it's safe enough for us to take it. I will ask you, Dr. Da Costa, to tell us a little bit about what the vaccine, the mRNA, what does it mean?
Thank you, Nelson. Those are really, really very important questions that you're asking, not just for the scientific and technical aspects of the vaccine and vaccine development, but because of public confidence, which Igor has mentioned, when he spoke very eloquently about it. One of the first things I say when I'm asked about mRNA vaccines is that this is certainly groundbreaking technology. However, we have to be cognizant of the fact that mRNA vaccines are going into humans for the first time ever. There have been many vaccines, as you know, developed during the course of history, getting on to close to at least 100 years. And over the course of time, there have been a relatively limited number of different vaccine technologies that have been used to produce existing vaccines. But now with the advent of mRNA, messenger RNA, and also DNA vaccines, these are some of the newer technologies coming in, and therefore haven't had the opportunity to be approved in vaccines that have been used thus far. So the one thing we have to be cognizant of is that both Pfizer and Moderna and a few others in development that are mRNA are seeing humans for the first time. That being said, the results that we have so far, from the trials that have been done in several tens of thousands of subjects for both Pfizer and Moderna are very encouraging, and have shown that in addition to the mind-blowing levels of efficacy that we've seen, we're also seeing preliminary safety data that are very encouraging. Now, in terms of efficacy, I just wanted to put something into perspective, which I probably don't need to do for the audience here because most of you are very aware, but the 95% and 94.5% efficacy that you're seeing from Pfizer and from Moderna as point estimates thus far are way above what was preemptively adjudged to be desirable for a new vaccine for COVID. So when vaccine development began at the beginning of this year, the thought was that if we had a vaccine that was 60 to 70% efficacious in clinical trials, that would be good because we would be essentially have the potential to mitigate against 60 to 70% of millions of cases, which is a lot. However, the first two vaccines past the post have come up with more than 90% efficacy. So that really raises the stakes. It sets the bar very high for all the vaccines that will follow. I think it's a very good thing for mankind because it gives the promise that we'll have a very effective outcome when these vaccines are widely used. I'm one to be very, very cautious. So to go on the safety side, I am very cognizant of the fact that as time goes along, we'll begin to learn more and more of these vaccines. When you test vaccines in clinical trials, there are limited numbers of people that get exposed. As you go through the phases, more and more people get exposed. But once you unleash the vaccine into the general public, you're then looking at tens of thousands, hundreds of thousands, in this case, millions and eventually billions of people who might receive these vaccines. And you begin to see that the less common side effects may begin to emerge. What the hope is that these adverse reactions or adverse effects will be tolerable. They will not be of severe nature in most cases, and there won't be any that are cause any of the regulators to cease distribution of the vaccine. But these are things that can occur. We have to be aware of, and we have to be mindful of, and we have to be vigilant about. So just to segue into the concern among the general public and concern among people of color, for instance, is that there is a legitimate basis that is based on the science. And that is that there are unforeseen potential for side effects for these untried, untested vaccines. On the other hand, a lot of the skepticism and vaccine hesitancy is not built on technical considerations, but built more on conspiracy theories, and also poor experiences. If you look at the Tuskegee Institute story with syphilis in African Americans and how those concerns have trickled down over generations, that is a legitimate concern. But if you look at some of the conspiracy theories being touted about people being tagged with various things in vaccines that might allow them to be surveilled upon by the government, and theories such as that really do feed into a lot of people's minds and make them hesitant about taking vaccines. These are not just conspiracy theories, but they're actually having an impact on a lot of communities. And when I say that, not necessarily in low and middle income countries, but in highly westernized, highly developed countries. So we have to be cognizant of the fact that there's a lot of skepticism around. We need to build confidence. Part of it is going to be under our control as healthcare providers to send out the messages like Prof. Igor has been sending, the confidence we have in the science and the vaccine. But part of it is going to be in helping to debunk some of the conspiracy theories that are going around that are just really fueling this vaccine hesitancy around the world.
So we've talked about the technicalities of the vaccine and why it is and what it is. Let's go to the community now. We have our physician, Dr. Nuruddin, who takes care of patients and is, very involved in the community. Dr. Nuruddin, what are you hearing in the community about the COVID vaccine? Are people ready for this vaccine?
No, I wish. Yes, I think some of the concerns were already mentioned. Dr. Acosta touched on the 2 or 3 reasons why people are reluctant to, get the vaccine. This is particularly among the brown and black and brown communities in New York City. And I've also heard similar issues from colleagues in Africa. I think the fact is, in addition to conspiracy theories around the messenger RNA, which some think it's a way of changing our genetic material or code and all that, and so for surveillance purposes. The other part of it is that the experience of the African Americans in this country that Dr. Costa mentioned, Tuskegee being the most prominent of those. So our role as physicians really is, how do we address these concerns? How do you talk to them? I remember during the AIDS epidemic, for example, in South Africa, there was a long delay before people were given the medication, the antiretroviral medication, because there was a belief that we can treat it with various kinds of herbal and traditional medication. So I think there is a lot of that also from our community. It's extremely important to get the information out. And I think the scientists that are here today are probably best equipped to go to the communities and tell them this is how we produce this vaccine. This is what's happening, and this is the efficacy of the medication. Of course, the physicians in the community have to do that, but more importantly, organizations like ours, like mine, in that Ambassador Siddiq started, had a responsibility. We've been running a series of webinars on the COVID-19, the misconceptions and all of that stuff like that. And I think we need to mobilize the religious community around the mosques and churches, and tell people, talk about the vaccine. We don't want them to be left behind. My concern is that they will not be considered first. I think we should push for that. And with the affluent countries already commandeering all the vaccines that are available now, I'm wondering what will happen to Africa, for example. So, of course, there are other vaccines down the road. So, but these are the issues that we have to deal with as diaspora community.
Those of African descent generally have about, the medical community is stems out of a history that's been purported all through, with what's been going on in this country. So there's a whole lot of distrust in the community. Nevertheless, we as experts here on to discussing this issue are the individuals who must create that confidence once again in our community, especially with regards to the COVID vaccine. Ambassador, Your Excellency, you've been engaged in advocacy work in the New York area. We've read so much about what you've done with equity and police brutality issues and justice in the community, and then with your work with the Pan-African organization, which you're a huge member as well. Now you're part of the diplomatic corps. What is it, I would ask, that the diplomatic corps, which you represent, has to offer with regards to COVID-19 and putting the message out there?
Thank you so much, Dr. Aluya, and thank you to all the scientists. I would like to start answering that question with a question. And that question goes to the heart of what we are talking about today. For the first time in the history of the world, with this incredible pandemic that has affected everyone, all lives, every corner of the globe, when you really look at what has happened on the continent of Africa, the numbers compared to what has happened in the industrialized nations of the world, our numbers are small. If you want to even say minuscule in comparison to what is happening in some of the greatest countries on the planet, with all the technologies, with all the scientists, with all the Modernas and the Pfizers. I think this world could pay a little bit of attention, bring about some civil degree of humility to looking at Africa. Why are the numbers so small in our country? And that brings me to a larger question, and which actually involves you too.
Right.
You cannot, nobody could decide on talking to people, influencing them when they are messengers, the people they trust, the people that they believe, they are faith-based leaders, they are community leaders, they are doctors, they are scientists, are not at the table. That is a serious policy issue. The world is now talking about, it's a global village. We have to collaborate. This disease does not discriminate. It's not say because you're blue, black, yellow, or green. This disease is called a pandemic. And as a pandemic, it involves all of us. So therefore, the solution should include the critical stakeholder players that people trust. Religious leaders, community organizations, faith-based, you name it, women, children, women organizations, our political leaders in our part of the world. Yes, scientists have done a lot. And everybody asks me every day, even our ambassadors now are asking, are we going to get that vaccine? Some of them are concerned. So it is up to you, the scientific community, to give us that level. I was going to ask a simple question. Any of you, I would like to see all of you to get that vaccine first. And then Dr. Aluya will tell me everybody got a vaccine, then I'll do that. I yield back this.
No doubt, Your Excellency. For sure. Thank you for raising that issue. It's very important because if they must get our members in our community, the African diaspora community, to buy into receiving this vaccine, and I'll give this question to Professor Ofotukun. If I take the first vaccine from Adama, can I take the second shot from Pfizer, or I must stick straight to the Moderna one?
if you took the Moderna vaccine, the first dose, your second dose should also be Moderna vaccine. So they are not interchangeables. And I think the way this is going to be operationalized is that it's very likely that all of the vaccines, a particular healthcare center will have one particular vaccine. And if you look at the vaccines themselves, they are not very different. They are all, so the Moderna and the Pfizer vaccine that will now be available, they are what we call the RNA, the messenger RNA vaccine. They are targeted towards a particular protein, what they call the receptor binding domain of the spike protein. So whether it was made by Moderna or made by Pfizer, the technique of making it is different, but it's essentially the same product. And that is why the results are almost identical. And so I don't think, as of now, there's no data to suggest that one is necessarily better than other. And I would take whatever is available in my healthcare system.
Dr. Terence Baker, you've done amazing work on, the COVID-19 study. You've given a lot of in-service and Zoom meetings as well, and recordings that you've done. What's your take on the COVID vaccine, especially in the Black community?
Well, first off, the SARS-CoV-2 disease process in Africa has been restricted naturally in many ways. We don't know that restriction, that is that the frequency of sickness will stay low once the world starts opening back up, because one of the things the African nations did is they closed their borders rather rapidly. For example, Kenya had a massive shutdown immediately and maintained it for months. And so we don't know what will happen to Africans once they start hosting visitors to their land from Europe, where the pandemic continues to rage, from America. Cruise ships begin to make their tours back into Africa. We just don't know what will happen. I anticipate that there will be some increase in illness. And back to the point. So despite that natural immunity and doing a good job of shutting down borders, I think that the African nations are building a collaboration with the Chinese, the Israelis, the Americans, and the Europeans to have the vaccine available. And I think those type of networking opportunities, for example, the Chinese, despite all the politics, have been generous, at least on paper, in making offers to assist with that. I'm hoping the Biden administration will be as generous with doing that. I hope that the manufacturers of drugs, which in the past have been generous to providing medications to the African nation, will be as generous in their distribution. Time will tell.
Now, one final point, and that is for the diaspora here, because I lived here for 40 years, I know what we go through. Dr. Nur-Hussein clearly stated about the challenges that our people here face. If you are not working for an organization or an institution that could provide you health insurance, that is going to be a dissuading factor for some people to access this epidemic. I would strongly urge and beg this country to making sure that particularly our undocumented immigrants who are in this country, they will be afraid to access the vaccine, thinking that if they go there, they're going to be given their information and ICE and others are going to deport them. So that is a real concern here. We have seen cases where people died at home for fear that if they access the medical institutions, they were going to be prosecuted. So I really will hope that there will be a major statement from the president, from the authorities in this United States, that anyone that goes to access or to be vaccinated, they're not going to be asking them, where's your green card, your blue card, your red card, your white card, and so forth. And from the standpoint of the African Diplomatic Corps, we have really been talking about really working more closely with our African professionals so that we could see how we could collaborate and bring these issues to our governments at home your participation on home, and also the governments here. I yield back, and I thank you very much. I didn't see Moses. I saw him going around, but I want to end up by saying to really commend him for the incredible service he has done for our communities in this United States. NAB TV has done a yeoman's job to bring credible and reliable information to our community. So I want to thank them for the opportunity, and you, Dr. Aluya, for participating today. I yield back. I thank you so much.
Thank you, Ambassador. You raised very cogent points there, no doubt. We must organize here to be able to save our people back home. And of course, the government's purchasing power back home, we don't have it, so we must organize from a building block upon which they must begin to source for this vaccine. And then, of course, for those who are here, the immigrant population and the undocumented is really important. And those are questions that come up. I must say thank you all for taking the time out of your busy schedule today to stay on this long to talk about issues that really concerns us, that is important, because these are problems that we face, and you know, the jury's out there. The information is so scarce, but then having experts like you all, and you know, community leaders and those who have a stake in our community come to talk about this gives us the comfort and hope that this would there's a bright future and bright light at the end of the tunnel. So before we go on to our break, I must say, Dr. Terence Baker, thank you so much for coming on the studio, for the work you've done in Africa, for the African Diaspora community. I thank you. And no doubt we'll call you on further issues and episodes that we have so that you can come talk to us about this. Thank you very much.
Thank you for having me.
Thank you.
New Africa Broadcasting Network.